Hello and welcome from the Army Heat Center. I'm PA John Raines. Today we'll be discussing profiling and return to duty for those who have suffered exertional illness. Our goal today is to share with you guidance on recovery profiling after an exertional related injury. This presentation will give specific information for using the Army e-profiling system, but will also cover general principles that can be applied to all branches of the DoD. Service members could experience exertional-related illnesses as a standalone condition or a combination of conditions. A quick review of exertional-related illnesses that impact our service members. The most common exertional illness you are likely to encounter is heat exhaustion, with the hallmark signs of core temperature less than 104 degrees Fahrenheit and the inability to continue training due to weakness, fatigue, unsteady gait, dizziness, and the patient may also have nausea and vomiting. Heat exhaustion may also be accompanied with end organ damage such as transaminase elevation and acute kidney injury, with some degree of rhabdomyolysis. Much more concerning and clinically significant is exertional heat stroke, characterized often, but not always, with a core temperature of 104 or greater. Typically there will be a collapse, but the key differentiation with exertional heat stroke is an altered mental status, delirium, stupor, typically seen during or immediately following the exertion. Exertional rhabdomyolysis may be a standalone diagnosis or may accompany the previously mentioned heat illnesses. If a patient has severe muscle symptoms such as pain and stiffness or weakness, and they have a CK level greater than 5 times the upper limit of normal, it must be considered. Experiencing headaches, vomiting, especially clear fluids, even altered mental status without an elevated core temperature could point to exercise-associated hyponatremia. This illness could occur during, immediately following, or even up to 24 hours after prolonged physical activity. If the patient is experiencing these symptoms and they have a serum concentration of sodium below 135 millimoles, it should be considered. Finally, we look at exercise collapse associated with sickle cell trait, or ECAST. Though not common, it usually follows after extraordinary effort manifested by unusual muscle weakness and pain. There may only be a modest temperature elevation, or it could be normal, with some central nervous dysfunction. Unfortunately, ECAST can rapidly progress to a much more serious outcome. Let's take a look at an example of a heat stroke patient and how we would move to profile the individual. This patient was conducting a 10-mile timed foot march, and at mile 9 he was noted to have a wobbly gait, so he took a knee. During the evaluation, it was appreciated they had an altered mental status and a brief loss of consciousness. Unit personnel ice sheeted him, and EMS upon arrival noted a core temperature of 107.6 with an ED arrival temp of 102.9. Note the lab findings. In addition to heat stroke, he was diagnosed with rhabdo. He was summarily scheduled for discharge with improvement of his symptoms and labs. He is to be given, with his discharge instructions, a duty-limiting recovery profile. Following is an example of how to accomplish this task. Producing a profile. There are 2 avenues available in order to generate an e-profile. You can go directly to medpros.mods.army.mil, or located inside patient's Alta record on the left-hand column under folder lists, you will select Army Readiness. Then select e-profile. This will then begin the process of launching MedPros. Using either avenue, once inside MedPros, select Healthcare Portal. Search in the upper right-hand corner with the member's DODI or SSN. Then select Add Condition. You are now on the Add Condition screen. Since this is expected to be a transient illness, you will always select Temporary for the initial profile. You will then be prompted to select a template. Now there is a prompt to search by template. This is a convenience function and helps with timeliness and uniformity. In the aforementioned case, you may type in heat, and a selection of pre-populated templates will be displayed. Currently, there is no template that exists either for ECAST or exertional hyponatremia, and we will discuss their management separately. Displayed before you are a selection of templates. Now is a good time to pause and discuss some terms and considerations related to e-profiling. Of special note, any selected category of heat illness noted in the focus area once published will be listed in Block 15 under Reason for Profile as a heat injury. This is intended to communicate a broad idea of a patient's medical condition to a non-medical commander, much like ankle injury would be used instead of a specific diagnostic code such as strain of anterior tibialis. Second, when selecting a heat stroke template, never initially select heat stroke with sequela, as it remains to be seen if concerning end organ damage will be persistent beyond the first 2 weeks. Reserve that selection for recalcitrant cases. Lastly, as you move through progression and duty restriction, you will see the term phase, which is used to communicate to the patient, health providers, and commanders where in the recovery process the patient currently is or will progress to next. This is how phasing typically works. Notice a progression with more and more activity leading up to a full return to duty. Keep in mind, phasing can always be adjusted if there is a setback or upgraded faster depending on a recovery response. If your patient has suffered rhabdo, these are the templates that a PCM, specialist, and/or physical therapist might use during recovery. Remember, the templates are designed for uniformity and timeliness, but they can be adjusted to your particular case should it be unusual. Once you have selected a template, you will see a variety of drop-down screens. I draw your attention to the mechanism of injury and the expiration date. Both need to be selected or the system will prevent you from further profile creation. Regarding the expiration date, keep in mind it is important to allow sufficient time for initial recovery and reconditioning in your initial expiration date. If more time is needed toward the end of the set expiration upon reevaluation, the profile can be extended. Example, you might want a patient to be on a profile for 2 weeks while the lab values stabilize and symptoms subside, but that does not necessarily mean the patient will be available for a physical fitness test the day after that profile expires, so make sure to adjust, allowing for appropriate time for reconditioning. The system will ask for availability for performing a record Army physical fitness test. Select No. Then select the date you believe the patient may be ready for this timed event. Remember, the profile expiration date should include this time. It is important to understand that advancement through phasing is at the discretion of the provider managing the patient. Profiles can be reduced or it can be lengthened depending on the clinical course. Also, recovery management of moderate to severe cases of exertional rhabdo are often a team approach, working with both medical providers/specialists and physical therapists. Profiles can be adjusted by either. Templated profiles have pre-populated instructions for both commanders and the patient, which can be manually adjusted if need be. A current active temporary profile may be open for the purposes of extending and modifying, extending without change, or if this is a refractory or repeated multiple heat injury patient, can be converted to permanent for the purposes of referring to the Individual Disability Evaluation System, or IDES. As mentioned earlier, the e-profile system does not have templates for ECAST or EAH, but in cases where these two maladies are concurrent with heat illness, dialogue can be added to the templated heat illness condition to reflect these two conditions. If, on the other hand, one of these two non-templated conditions are the only illness that the person is suffering, then a general non-templated profile may be used and restrictions tailored to the conditions may be listed. Note the examples listed on this slide. You would tailor your restrictions on a non-templated profile accordingly. Let's see how we can put this together on an actual case and how it would typically look on an e-profile form. As mentioned earlier, we had a patient that was diagnosed with heat stroke, and you decided to issue a profile. A standard exertional heat stroke profile is 10 weeks. That can be adjusted, as mentioned earlier, but the templated amount is 10 weeks. Rhabdo can be listed as well and would be listed in Block 15 along with heat injury. Special note, keep in mind if after 2 weeks the patient has persistent symptoms with continued abnormal lab values, a new profile can be issued as a heat stroke with sequela and managed appropriately. Highlighted on this heat stroke profile, you will notice in Block 15, reason for profile. It does not say heat stroke, but rather heat injury, as mentioned earlier. Listed in Block 5 is the first phase activity guidance instructions and anticipated timeframes. Further instruction for individual physical events is given in Block 30. In this case study, an active duty member has signs and symptoms consistent with heat exhaustion with typical labs that one might see during evaluation. In this example, the patient had previously had another episode of heat exhaustion, so some consideration might need to be given for recovery timeframes outside of a normal one-time event. The decision to give a typical 7-day templated or extended profile likely will rest with the PCM, but an initial 7-day profile is appropriate for discharge from the emergency department. The selection of a heat exhaustion template will generate these recommended Block 27 and 30 duty modification guidelines. Please take a moment to consider this case. The final example we will look at is the case of exertional rhabdomyolysis and noted sickle cell trait. Keep in mind, if the patient has refractory creatinine values, a nephrologist might use muscle tissue breakdown phase 1, but otherwise progression would be through phases 2 and 3 as appropriate, working with physical therapy. In this example, reason for profile in Block 15 is breakdown of muscle tissue, phase 2, and noticed in Block 27 a progression has been demonstrated to show a certain level of recovery. So the point here is adjustment, adjustment, adjustment as the clinical picture improves. As always, the medical team is working toward maintaining the fighting strength with a return to deployability. If you're in need of further assistance, our contact information is on the next 2 slides. Much success, Army Strong.